the 5th time. This is the os coxae. The best way to determine left from right is to put your thumb in this notch right there. If you put it up to your mouth, or you put it up to your ear and your mouth, this will be the left side if it feels right. If not, it's going to be the right side. Another way to determine these notches right here are always posterior. So your posterior side on the back, anterior side on the front. There are 3 parts to the bone we talked about. The first part is going to be the ilium. The bottom 2, right here, this is going to be the pubis, and this is going to be the ischium. So everything that's going to be found in there, for the most part, is going to have the name of the bone location. So we're going to start with the ilium up top first. You have this crest that runs along the top. This is your iliac crest. You have a small roughened projection right here. That's going to be your iliac tubercle. You have the depression on the iliac. This depression is called the iliac fossa. Where the sacrum attaches for each pelvic bone where they connect, the sacrum in the middle, this area is called the articular surface. You have 4 spines on either side of the iliac. On the anterior side, remember, posterior notches. On the anterior side, you have 2 spines right there and right there. The top one is going to be superior, bottom one's inferior. And since they're anterior, they're going to have that name anterior in it. So you have your anterior, superior, iliac spine. It's a spine located on the ilium, so it's going to have iliac spine. So this one is going to be your posterior, anterior, inferior iliac spine. Conversely, on the posterior side, these are a little bit more difficult to see, but you have to rub your finger over it and you'll feel 2 humps. Each one of those are a spine. So since this is posterior, is your posterior, superior iliac spine, which means this one is your posterior, inferior iliac spine. Going along with that, you have your arcuate line, which runs diagonally across into the pubis. And then posterior, you have these 2 notches where you can pretty much rest your fingers. Each one of those is going to be where your sciatic nerve bifurcates and splits off. So you have your greater sciatic notch and your lesser sciatic notch. In between the 2, you have this little spine, which is located on this little back part of the bone, which is in your book. It's purple. This is your ischium. This is your ischial spine. Along with that, you have your butt bone. This is like if you're sitting on someone's sitting on your knee or on your leg and they feel that bone digging into you. This is your ischial tuberosity. So remember, a tuberosity is any large roughened surface, ischial tuberosity. Any arm-like projection is called a ramus. So there are 2 rami right here. However, in the book, as you tell, they're split right here. This side is purple for the ischium, this side was red for the pubis. So this little area right here, the arm-like extension on the ischium, is just called the ischial ramus. However, for the pubis, the red part over here, there are 2 rami. One that's split right here whenever the 2 colors are split, and then this one right here. So this one is on top of this one. This is superior, this is inferior. So this is the superior ramus of the pubis, and this is the inferior ramus of the pubis. Just this area right here is called the pubic body, and along that you have the pubic tubercle and the pubic crest. This is where that fibrocartilage pubis symphysis attaches the 2 os coxae, or the 2 pelvic bones together. You have a great hole right here. This is where the obturator nerve runs through it. So this is the obturator foramen. So any large hole is called a foramen, obturator foramen. On the reverse side, on the lateral aspect, you have this great little divot right here. This is the acetabulum. This is where the head of the femur connects into. So this is always going to be lateral. So on the body, it's put in like this, to where the head of the femur connects in like this. Connects in and allows you to kick outwards. Alright? So again, anterior, posterior because of the notches, superior, inferior. Alright? And that's it.